I hope you're enjoying your CS week so far, and I hope you're checking out these videos and enjoying them and getting your free CE as you go through your CS week here. Now, this presentation has everything to do about reviewing basic surgical instruments. And I hope as we go here, it will be review for most of you maybe that are seasoned sterile processing technicians. Maybe it's review, or maybe you pick up something here or there that might help you in your practice. But hopefully those of you who are maybe newer in the industry will find this presentation to be very foundational for your career in sterile processing. So without further ado, let's get into this one. We have objectives just like every other presentation. We're going to look at a history of surgical instruments. We're going to review the various types of basic surgical instruments and how they are used. And lastly, we're going to discuss a little bit about how having this basic understanding of surgical instruments is going to be vitally important for you to provide quality service to all of your customers, obviously people in the OR, but maybe clinic locations or offsite locations as well. All right, so let's get into objective one, where we review a basic history or a brief history of surgical instruments. As you can see there, it's just a picture I found of like ancient surgical instruments, which I thought was interesting. Another thing, looking at the timeline, that I was kind of surprised to see is that they found surgical instruments dating back to 8000 BC. And then in 3000 BC, they're using obsidian knives for early brain surgery. That's pretty wild. I had no idea that long ago they were already doing brain surgery. That's just hard to even imagine, especially since it was well before the development of asepsis uh, and anesthesia. So that's really interesting to me. And then you'll see during the Roman Empire in 260 BC, Roman medicine includes a little bit more complex instruments like speculums and bone forceps, saws and levers and all of this. And then you get into the 1600s and you start seeing scalpels mass produced by cutlery houses. You might recognize the name there in 1905. Gillette safety razor inspires a reusable scalpel. And then in 1915, you start to see modern two-piece scalpels patented by Morgan Parker. And then you'll see stainless steel becomes the primary material for scalpels, and also other surgical instruments as well. And well in from the 1960s and 70s, 80s, you start to see an increasing proliferation of instruments and the complexity of the instruments. Heat sensitive materials come out, modular or take apart instruments come out. One of the things that you're going to want to remember for later is that in the 19th and 20th centuries, the reason why surgical instruments started to really get produced at an increasing rate and widely proliferated was because of the development of both asepsis and anesthesia. And that's what that picture is there to remind me to tell you. That's a drawing depiction of Dr. Lister operating. And one of the things that was unique about him was the development of germ theory, which led to the development of asepsis, which then led to us, here in the 80s, 90s, and 2000s to be able to focus our advancements on the instruments, making them more complex with lumens and combinations of polymers. And then we end up with robotic instruments. All of these things are enabled because of uh, antisepsis and anesthesia. That allows us to focus on advancements in surgical technique, which requires all of these surgical tools to advance as well. So very interesting, I thought. But moving on, one of the things that was common in that timeline that we saw is the stainless steel, especially once we get hit the 1900s, right? This is the preferred and most common instrument material. It contains iron and chromium. It withstands repeated use. It withstands repeated processing. It withstands high temperatures that are so often related to the sterilization process, which is really important. And there's some things that we need to know about the grades that the stainless steel instruments come in. So we have surgical grade and we have floor grade. Surgical grade should be what you most commonly see that is going to your operating room. Floor grade is called floor grade because maybe it's used um, in an inpatient unit, or maybe it's used in a clinic. Most often, these floor grade instruments are actually single use. And one of the differences between surgical grade and floor grade is there's no passivation process taking place after the manufacturing. So they're subject to wear and tear and corrosion and breaking and all of that. One of the indicators that we tend to see with floor grade instruments is that it will say Pakistan stainless steel, or as opposed to German stainless steel. Um, a lot of times you might see a mirror finish on these instruments. That seems to be pretty common with floor grade. Another thing you might see is the absence of a reference or model number on these instruments, as they're not really meant to be reused. Now, they are stainless steel and they can be sterilized, but like they're just not supposed to be reprocessed in most cases, unless it comes with an IFU for reprocessing. Then it is really meant to be single use and discarded. Another thing about the grading system of stainless steel is that you have 300 level categories and 400 level categories, and these are typically what comprise your uh, the surgical instruments that are non-floor grade or surgical grade, right? So the 304, 316 grades, these are categorized as austenitic. They're very common for surgical instruments. They contain high levels of nickel, and this leads to exceptional corrosion resistance, and it's also non-magnetic properties, because and that's going to be important as we go, that is non-magnetic. Hopefully you can see this, but the suction tubing is just um, that's an example of a 300 level grade of stainless steel. Then we have 400, which is known as martensitic. This one has a high chromium content with no nickel. It has acceptable corrosion resistance, but you can see that it's going to be a little bit more susceptible to corrosion than the 300 level. It prioritizes hardness, which this is an example. It's just a Kelly clamp here, but needle drivers, those are a great example as well. These are going to be uh, more hard than the 300 level. And unfortunately, another thing about the 400 level is it can be magnetized, which is generally a negative thing. So I mentioned needle drivers as an example, and that's why, especially with vascular needle drivers in particular, those seem to be really subject to magnetization. But any instrument in this 400 level could become magnetized. And so it's a really good idea, especially with those needle drivers, that we are testing for magnetization, or putting it through a demagnetization process. So moving on, there's also the manufacturing process that includes forging, grinding, and milling, assembly, um, especially for hinged instruments, right? Or take apart instruments or modular instruments. Then there's heat tampering or tempering. There's polishing that uh, has different finishes. And then there's that passivation process, followed by etching and then final inspection and packaging. So types of finishes, you might have a mirror finish or shiny. As you can see more with this instrument is a little more mirror finish, as opposed to this instrument, which is more of a matte or satin finish. So it's non-reflective, which is a nice property with surgical instruments. Working in the operating room, having a shiny or mirror finish can sometimes reflect the light into the eyes of those who are either performing the surgery or helping perform the surgery. So, um, generally speaking, that matte or satin finish is preferred for use, but mirror finishes tend to hold up better against corrosion. So, those are some things to know about with the different finishes. What about that passivation process? Well, this is the removal of iron from the surface of stainless steel using citric or nitric acid. It produces a thin, primarily chromium layer, and it turns out that this is a protective layer of the instrument. It's a protective oxide layer, and it's resistant to rust and corrosion. And then the sterilization process helps to continue to build up that passivation layer. Now, unfortunately, that passivation layer is subject to damage as well through regular use or maybe exposure to blood or other chloride containing solutions like saline, specifically, or even blood, um, which I already said. So, blood or saline. Uh, Also, the repair process. So, if you have a contracted instrument repair vendor, make sure that they know how to repair the instruments, but also um, repeat passivation process if needed. Also, damage like cracks or pitting can inhibit your passivation layer as well. So, just kind of going over some basic anatomy of an instrument. Um, on the left here, we have kind of like a clamp type instrument, and then on the right, we have a scissor. So over here, we have a jaw. On this side with the scissor, we have blades, and both of them will have a box lock. Um, and then if you flip it over, you'll tend to see a screw on at least one side. Then you have the shank between the box lock and the finger rings, and then you have these finger rings right here. And then if you have a non-locking instrument or a scissor, then you're not going to have this ratchet that you see over here. This ratchet is what makes it a locking instrument. Um, Sometimes that ratchet is really long in the case of reduction forceps. So that's really important to know as well. But the jaws or the blades, those are the working end of the instrument. And then the finger rings is obviously where the surgeon or the assistant are actually going to hold the instrument. One thing about the shanks is to understand that that's typically where you're going to get the length of your instrument. So you could have like a standard size, you could have a medium size, a long size, and even an extra long size of these instruments. And typically, what you'll see is that size is really determined by the length of the shank. So that's really the main difference in the size of the instrument. You shouldn't necessarily see a difference in the jaw size or blade size, with the exception of things like vascular instruments. They might, or micro instruments as well, will have smaller blades, smaller jaws sometimes. And then we have retractor type instruments like you see here. We have the retractor blade up here. We have the overall length here. We have the shaft right here. This is referred to as a horn, but it helps when it comes to gripping the retractor, especially throughout a procedure. And then this whole handle here. And this is just a variation of a similar retractor. I believe these are both variations of Richardson retractors, just with a different type of handle. All right, so what else do we need to know about these instruments? Well, they could have serrations, and those serrations could be traumatic or atraumatic. And what I mean by that is traumatic serrations can actually cause damage or trauma to the tissues that are being operated on. And this is an example up here uh, of a traumatic instrument because it has claws, basically. That's a Leahy clamp. Um, and that's going to do damage to the tissue. Okay. Versus this one has a horizontal serration. And this is also maybe known as a smooth pickup. But it does have serrations, even though it's not necessarily smooth. Sometimes you'll see longitudinal serrations, and sometimes you'll see diamond serrations, and those are typically found on needle drivers. But again, they can be traumatic or atraumatic, and that can happen with clamps or forceps, or even retractors. Sometimes retractors have traumatic versus atraumatic features as well. Then we have instruments that come in multiple pieces. Now, this is an example of a self-retaining retractor. That's the type of instrument. The name of the instrument is a Balfour retractor. And what's interesting about this one is that it has a wing nut right here, and it has screws. And actually, this is a great picture because we have one screw here and then one screw is missing. And so these screws and this little plate here hold this blade on. So this whole retractor arm and blade could slip right off if those screws were both missing. Um, Also, what's really important to notice here is that when you have multiple pieces, retractors like this, sometimes you might have to take them all the way apart, obviously, for the cleaning process. You may or may not have to take them all the way apart for sterilization, but they should be at least loose. Always recommend following the IFU for that. Um, but if you're one of those facilities that kind of puts this retractor blade here on there prior to sterilization, it's going to be really important that you know which direction these go into. Sometimes I see this one facing the opposite direction, or maybe this blade over here is facing the opposite direction. So you need to know how these pieces are meant to be orientated when you put them together. All right. So what other instrument characteristics do we need to be mindful of? Well, if you see gold ring handles, that's usually an indicator that there is a tungsten carbide insert. And that tungsten carbide is essentially like diamond like material. It's extremely hard and it's really good for gripping needles. And that's why they put it in needle drivers. You might also see it in scissors because it holds up very well and it's very sharp. But you might also see black handles, which are an indicator of supercut. Sometimes supercut instruments have a serrated edge on them, which is a little bit different than some of the other types of scissors that have a smooth edge to them. But anytime you see those are indicators of something that's going on that's unique about that instrument. One thing to keep in mind with the gold ring handle or black handle is over time and over use, those characteristics like the gold could be worn off or the black can wear off just by normal wear and tear. That doesn't mean that the characteristic of it having tungsten carbide isn't still there, right? So the idea is that it still would have a tungsten carbide insert, right? The gold is really meant to just be a visual identifier of that type of instrument. And then lastly, the other thing that we're not going to go down this rabbit hole of how do we test insulation, but you should know when you look at instruments whether or not they're insulated, um, because those types of instruments are used with cautery and they should trigger in your mind that, oh, I need to test that and make sure the insulation is intact and working properly. But that is also a visual cue that that instrument is used with electrical cautery. which is really important. All right, so switching into objective 2, we want to review the various types of basic surgical instruments and how they are used. So we talked about this a little bit, but we have ratcheted forceps and clamps. These can grasp or hold tissue. An example of this would be a hemostat, and that's used to occlude a blood vessel. It can be used for other things as well, but that's the primary purpose. Then you have non-ratcheted forceps that are used to grasp or hold tissue. And an example of that would be a DeBakey. It's almost like an extension of your fingers or your hand, those types of forceps. Some might refer to them as tweezers or what have you, but those are forceps. All right. And then you have things like dissectors or scissors. These are used to cut or dissect tissue. An example would be a Metzenbaum scissor. These are used for fine, sharp dissection of delicate tissues, whereas a Mayo scissor is used for cutting heavier tissue. You might see a curved Mayo scissor. Still, you're cutting thicker, more tough tissue with a Mayo scissor. Straight Mayo scissors are also used to cut suture as well. So just as an FYI, retractors are used to move tissue out of the way, or organs in some cases, depending on the procedure. A basic example of this would be a Richardson retractor. You could use that for moving skin and subcutaneous and fatty tissue out of the way on maybe a deeper uh, surgical procedure. You might use a rake retractor. You might use a Sen retractor. There's all different kinds. And remember, in a slide or two ago, we talked about the self-retaining retractor. So nobody's holding a self-retainer retractor. You're just putting those in, setting them up, and then they stay open on their own, which frees up the hands of the surgeon or the assistants. Then you have dilators and probes, needles and cannulas, and needle drivers. Needle drivers are important because we use those to ligate or for suturing and closing wounds. All right. So one of the things that I think is really important is in understanding how instruments are used is actually kind of getting a visual of how they are used. Now, I hope this part of the presentation doesn't make anybody feel nauseated or anything like that. This is not a real surgical procedure. This is actually a video I found where they show surgery performed on like a model, if you will. So, but I thought it was a good illustration of how the instruments are used, and we can kind of explain what's happening with these photos and how the instruments are being used. So, in this photo, we're trying to gain access to the abdominal cavity, and you can see the scissor here cutting through the peritoneum right here. And this is a curved Mayo scissor because this is a more tough tissue rather than a delicate tissue that the instrument is being used to cut through. We also have, for exposure, we have two Gelpi retractors. These are self-retaining retractors that are holding open the wound. There's one up top here that's kind of hard to see. And then you have a surgeon with their left hand holding the peritoneum up with a DeBakey forceps, and then an assistant holding the other side of the peritoneum up with a DeBakey atraumatic forceps. All right. Then after they do that, they start to put in place the Balfour self-retaining retractor. So they're going to keep all the layers of the abdomen from skin down to the peritoneum open and expose the bowel underneath with this Balfour retractor. And then you have them, they're doing a bowel resection in this video simulation, and they found the blood supply to the bowel that they want to remove. And now they're placing a clamp on that blood supply. And what they're going to do is they're going to place another clamp on the blood supply and then cut in between them with a curved Metzenbaum. All right. It's a little bit more delicate tissue. So now we got rid of the curved Mayo. We're going to use our Mets. And then after that, they're going to tie those off so that there's no bleeding. They'll do that with some suture. But that's the main part where they have to, when you do a bowel resection, you have to take away the blood supply to that section and make sure that there's no bleeding when you remove that bowel. So here we have a section of bowel that has now been freed from its blood supply. And so you can see there's a clamp being placed across there and another clamp right there. So they're getting ready to resect that part of the bowel. So now they have 2 clamps on each side, and they're going to cut in between those clamps. And that way, none of the bowel contents fall out. They can just cut it. And then those scissors or the knife, whatever they use to cut there, will probably now be considered dirty or contaminated at least. And they'll have to isolate those away. But those are how you're going to use your clamps. Now, in this case, they were using cokers or Oshner's. And that's another thing you're going to want to know is different names for this, for various instruments. Sometimes they have multiple names. But you could also use Kelly clamps here. There's also intestinal clamps that could be used here. So there's a variety of clamps that could be used for the same purpose. So that's really important to know. And then here they're starting to put the bowel back together, and that's where they're using the suture, and eventually they're going to use an automated stapler device and all of that. That's not as important to know, but you can see how all of these instruments are being used, and I think that's really helpful for understanding the instruments, why they're so important, why we need so many in a certain set. If you're doing a bowel resection, you might need a bunch of cokers or a bunch of Kelly clamps or a bunch of hemostats. So the number is important sometimes. So in this particular case, they're using the retractor still, they're still using the cokers, they're still using their needle driver, and they're using a hemostat to hold their suture in place as well. So now they finished their bowel resection and they're getting ready to close the wound and starting from the innermost part. So they're going to be working on closing the peritoneum here. And you can see our Gelpies are back. So the Balfour was removed. Our Gelpies are back. And now we've added an Army Navy. Sometimes it might be a Richardson, and they're going to lift up here and expose the opening here so that they can suture it and close it. So now we sometimes see surgeons, they'll use a malleable to put in this wound and make sure that you don't accidentally suture any of the bowel underneath. So there's a possibility for that. And then obviously now we don't have any of the clamps or anything like that. So hopefully kind of going through that procedure with the basic instruments helps you to understand just a little bit about how they're used, why they're important, why there's a certain number of them in each set, that kind of thing. And then now we can move on to objective 3, which is discussing how having a basic understanding of surgical instruments is so important for providing quality services to the customers of sterile processing. So let's consider some of this thing. What we want to do with any of these educational programs is we want to further empower sterile processing to provide excellent service. And one of the things about knowing the names and functions of basic instruments, it really does help us to better serve the OR. For example, if a circulator runs out of the room, or maybe they call sterile processing, and they're looking for an instrument, maybe something fell on the ground, maybe they need help finding peel pouched separate version, or maybe the peel pouch they've already searched, they couldn't find it, and now they need help finding that instrument maybe in another set or something like that. we can then go ahead and find that instrument. So as long as we know the names, right? And we know basically what instruments are in what type of sets, we can better help find these things. Um, it also helps us to understand the most challenging areas of the instrument to clean, which leads to better cleaning and inspection practices, right? If we know what areas are difficult to clean, like say a box lock or maybe the serrations on a coker, um, or even an Adson, like where the teeth are on an Adson forceps, we're going to look at that uh, more rigorously. We're going to look more closely and we're going to spend more time cleaning those areas, or maybe a Yankar suction where the tip unscrews. We're going to look at those threads and make sure everything is cleaned properly, right? So if we know all of those things about each of the different types of instruments, just like I mentioned about how knowing which way the Balfour goes together. Sometimes the Balfour retractor comes with 3 pieces, 4 pieces, depending on the model. You might have 8 pieces to your Balfour retractor with interchangeable blades and different screws and all of this different stuff. So it's really important to know the orientation of everything once you put it back together. Um, or even if you put it back together for sterilization, right? So we need to know all of those things and where to find that information in the IFU. Another thing that's really important about knowing your instruments, um, is that it helps us to see the value in proper and consistent function testing of the instruments during the assembly stage. All right, so for us, that might mean scissor function testing. There's other things that we might do. We might even lubricate the scissors because they're sticking. Imagine trying to cut a blood vessel or do surgery on a blood vessel, or a bowel, and having scissors that have a nick in them or they're sticking or something about them is not functioning properly. So it's really important that we understand what these are for so that we know exactly how to make sure they're working properly. The other thing is we also need to protect these expensive assets. Surgical instruments are very expensive, very costly assets that that the hospital invests in. So we also need to maintain them. We also need to send them maybe for repair. We might have to replace them when they come to end of life, or when maybe there's damage involved and they could be risky to be used on a patient. So all of that is helped when we understand basic instruments. Um, the other thing is even though surgery is taking on more advanced techniques and it's becoming more minimally invasive, what's important to know is that even in those procedures, oftentimes we're still using basic instrumentation. So, say, for example, a bowel resection, sometimes they're going to do a laparoscopic assisted right hemicolectomy. So, they're taking out the right side of the colon. Um, they're going to do part of the case laparoscopically. And then a lot of times they're going to pull um, they're going to pull some of that bowel outside of the body and still perform it the rest of the surgery, just like they would have 10, 20, 30, 40 years ago, with regular standard surgical instruments like Kelly's and hemostats and needle drivers and all that. So it's really important that we understand even the advancements don't necessarily preclude the surgeon from having to use basic instruments. You probably have seen in a lap Coley tray, you have all those lap instruments, but you still have some basic regular surgical instruments in there, and there's good reason for that. So, um, and also there's always that option that any minimally invasive surgery could convert to open if needed, right? So, we might need to be able to either know to put that stuff on the case cart, or maybe they thought they were going to be able to do it, laparoscopic or with a robot but now they have to call you or yell out into the sterile core, hey, we need some basic instruments, and then you have to go and find them and get those for them. So hopefully kind of going over these examples and some of these basic instruments and their characteristics and what they're for, hopefully that makes you understand and see what I mean by how it's going to be foundational for you in providing excellent service to your customers in the OR and wherever else you have them. This is just a list of my references. Here, I just want to say thank you. Thank you for watching the video. Thank you for taking the time to educate yourself. Thank you for what you do every single day in sterile processing, as it is just foundational to patient safety in the operating room. They can't do what they do without you. So we like to say you guys are the heart of the hospital. I hope you have a great rest of your CS week. Thank you.